This is the continuation of the morphological and the general differences between the primary and the permanent dentition. Okay, now we will be discussing the histological differences between the deciduous and the permanent. So the histological differences in enamel, okay, differences in dentine, differences in your DEJ, differences in your neonatal lines, pulp chamber and all that. So this is your enamel on ground section, your dentine, and these S-shaped curves are the dentinal tubules, and then your pulp chamber. Moving on to the differences in enamel. The thickness of enamel is going to be very less in deciduous dentition, and it is going to be more thick in permanent dentition, and the enamel is less mineralized in deciduous dentition, it is more mineralized in permanent dentition. If you move on to the direction of the enamel rods, in deciduous dentition it is more incisal or horizontal or occlusally placed, whereas in permanent dentition it is more cervical placed. So the enamel is thin. Okay, the direction of enamel rods in deciduous it is more upwards, in permanent it is more downwards. Moving on to the differences in dentine. Dentine, if you take, it is thin as your enamel in case of your deciduous dentition, and the dentinal tubules are going to be less organized, whereas they are more organized in case of dentition. And moving on to the neonatal lines. The neonatal lines are more prominent and seen in the deciduous dentition, whereas in case of permanent dentition, the neonatal lines are seen only in the first permanent molars, not in any other two. So the differences in enamel, in deciduous it is going to be thin, and the direction of enamel rods are going to be more incisal, occlusal or horizontal. Enamel is going to be thick and more gingivally directed rods in case of permanent dentition. Dentine, it is more thin and irregular or less organized dentinal tubules in deciduous, more thick dentine with organized and regular dentinal tubules in permanent dentition. And the pulp chamber is large with highly placed pulp horns, okay, slender root canals with wider apical foramen, whereas the apical foramen is constricted in permanent dentition. And if you take, the accessory canals are more in number and the furcation area in case of deciduous dentition, and the neonatal lines are present in deciduous dentition, whereas in case of permanent it is only in the first permanent molars. These are the histological differences between deciduous and permanent dentition, which you will discuss under enamel, dentine, okay, dentino-enamel junction, neonatal lines, okay, and then your pulp chamber, your apical foramen. Thank you.